Mr. Holmes. My name's Damika. I'm going to be your nurse for today. I'm a student nurse, and I'm going to uh, change out your tracheostomy as well as change the dressing. Okay? I first need to verify your name and date of birth. Let me get some hand sanitizer. Okay, if you'll just nod your head while I verify your name, Jonathan Holmes, and your date of birth is 6/9/77. Okay, good. So while we're doing this, if you feel any discomfort, I want you to put your left arm up and make a fist for me, okay? All right. Now first we're going to go ahead, I'm going to listen to your lungs. While auscultating the lungs, I'm going to auscultate every lung field. Normally, I would go ahead and raise up the gown, listen to all the different lung fields. There's no distress. We just suctioned him earlier, so there's no rhonchi. And I have my oxygen here on the wall, so I will be able to oxygenate him prior to me switching out the arbitrator, as well as I'll have suction if I just absolutely need it. So we're gonna first take off, I'm gonna have on regular gloves, and first I'm gonna take off all his old cannula and dressing, and then I'm gonna put on a new disposable cannula and dressing. So first I would clean my hands again. Then I'm going to open up everything away from me. Only touching the edges. My table has already been cleaned off. I have my mask. I'm going to put on my mask and face shield now. While having on my regular gloves, I'm going to go ahead now and remove, I'm going to go ahead and oxygenate him. Then I'm going to remove the old cannula. Pressing down, holding this. I would also have a waterproof pad here to put all my, thing that I need in case anything gets on his clothing. I would throw this away in my trash receptacle. And I'm going to take off the old dirty dressing, throw that away. Now at this point, I'm going to go ahead, take off these old gloves, go ahead, clean my hands. Going to open up my new gloves. I have some saline here. Also, these are my new sterile gloves. I'm going to, before I open them up completely, I'm going to go ahead and take my box out. I'm going to make sure I'm careful not to touch along the edges. Not touching inside the box. I'm going to make sure that I take some saline, only put 1 inch of saline inside. And now I'm going to go ahead and take my waterproof pad. Only touching the edges of it. Gonna put this across his chest. Put my gloves on. Keeping in mind I already have on my face shield. And I did have to switch out the gloves because my hands are big. And these gloves seem to be small as well. But I'm going to keep moving as though my gloves are okay. Because I don't have any more. Okay, so now I'm going to get the new arbitrator. I'm gonna go ahead and put in the new arbitrator. Snap it in. Now I'm gonna go ahead and clean his stoma. Cleaning around the stoma, starting at the stoma and going away from the stoma. Throwing it away in my trash receptacle. I'm pretending that there is a trash receptacle here. Cleaning away from the stoma. Now that I have it cleaned, I'm now gonna pat dry the area that I just cleaned. And then I'm now going to place the new dressing around his stoma. Sorry, my whole tracheostomy is falling apart, but for pretend. So now that I've gotten my tracheostomy and everything together, I've changed the dressing using sterile technique or aseptic technique. Now I'm gonna change out his trach ties. So it would take 2 people to do this. I would disconnect this one from this side, having the other nurse to hold on to his tracheostomy, then pressing under his neck to the other side. And then if I was the other nurse, I would take that, go ahead, connect it to it. Now that I've changed everything out, I would take all my stuff and now throw it away and dispose of it. Get rid of everything. I would document and I've already connected the patient back to oxygen prior to doing his trach ties. I would go ahead, make sure the patient tolerated everything well, make sure there's no pain, no discomfort. I would document everything that I did and that he tolerated it well. I would continue to document his SpO2 level, his breathing was even and unlabored, and that's it. Thank you.